Hey guys, welcome back to my channel. Today I wanted to talk a little bit about Alzheimer's disease. For those who do not know, June is Go Purple for Alzheimer's and brain diseases. So I thought I would just give you guys some warning signs, some things that happen along the process of being diagnosed and dealing with Alzheimer's disease. I am someone who has had family members obviously struggle with this disease. I have also obviously worked in primary care where this is, common, and it can be very sad at times, and other times you can kind of sit back and laugh at certain situations. So I hope that this video is helpful for those who may be dealing with someone in their family or a close friend, or maybe even you yourself are in the beginning stages of Alzheimer's disease. So let's go ahead and get started. Okay, for those who do not know, AD is the most common form of dementia. AD affects more than 5 million Americans, and they say that by the year 2050, that number would have tripled. Let's go ahead and just review 10 of the warning signs of AD. You have to have more than just one or two. So for those who are watching this video and thinking, oh my gosh, I have Alzheimer's disease, like obviously you should see a physician if you do feel you have or are experiencing with a loved one these symptoms. So we'll just go ahead and go through those. Number one is memory loss that disturbs your daily life. So things that you should be remembering or have always remembered, but now you are slowly starting to forget certain things, and things aren't adding up. Number two, challenges in planning or problem solving. Now, this one, obviously, I know there are going to be people who are like, I've struggled with that all my life, but this is a obviously serious challenges that are occurring frequently with being unable to kind of schedule your day, solve problems, plan in advance. Three is difficulty completing familiar tasks. We find that they have to relearn a lot of things that should come naturally to them. So like holding your spoon properly. Obviously, you are not going to be seeing those necessarily right off the bat. Maybe they used to be able to start a lawnmower, but they can no longer do it. Not because they haven't done it for a while, but just because they forget. So you need to be looking for certain things like that throughout, whether it's your life or a family or friend's life, that they can no longer accomplish. 4, confusion with time or place. In the healthcare field, we will give what is a mini mental exam, which you will hear me talk about this later in this video. It is simply a short exam of a series of questions, and one of those questions is, do you know our location? Do you know what county we're in? Can you tell me the time? People with dementia are not always sure of what day it is. Is it morning? Is it afternoon? Can you tell me the year? They have a hard time processing and giving you those informations of the day. Number 5, trouble understanding visual images and relationships. And what I mean by that is they have a hard time maybe looking at a picture and realizing what that picture is and what its relation is. Maybe you would have them draw a picture of a clock, and then you would need to have them tell time on the clock. Does that make sense? So that is a visual picture of an image, and then what that image does or produces. They do usually have a hard time doing that. It is a struggle. Number 6, new problems with word and speaking or writing. So back to the basics, something that they obviously should be able to do. Maybe struggling with it, struggling with finding the right words to say. Maybe they're starting to stutter. Maybe they're saying something, but they're a little confused as to what they're actually saying. Very big things to look for. 7, they are misplacing things and losing the ability to retrace steps. Now, everyone loses stuff. Everyone does. And even me, I struggle with replacing my steps with losing things. So obviously that is a concern for me as I grow older. But right now, I just need to be a little more organized. But when you see someone who has misplaced their keys, misplaced their glasses, and they cannot retrace the steps, they cannot tell you where they got. I know I had a beloved person that I absolutely loved, and he got to his appointment, but he couldn't remember where his car was. It's things like that, things that are important, everyday things that shouldn't be, I guess, as hard. 8, Number 8 is a decrease in poor judgment. People with dementia, some cognitive impairments, they are unable to make good decisions. Now, not all the time, obviously, but you will see just a little bit of hesitancy, I guess, as far as their judgment calls, just like turning the burner on too high, burning their food. Things that they would not have normally made a bad decision on. You're starting to see those things kind of creep into their life and you're not quite sure. And honestly, they might not even be aware that they're doing it. So number 9 is withdraw from work or social activities. Now, when you are dealing with someone who may be older, obviously, we do see that kind of geriatric depression that sinks in. Obviously, what's the point of living? I'm already this old. What does it matter? You'll start to see that with people who have dementia. They might not necessarily want to get out, want to move, because it can be confusing. They might not be sure what's going on. They have to remember pieces. They have to remember people's faces and names, and that might be starting to be a struggle for them, which obviously is going to make them want to stay at home. So that is something that obviously needs to be looked at and definitely evaluated. And number 10 is change in moods and personalities. Like I said, this kind of ties in with number 9, withdrawing from work and social activities. You kind of see that dementia and depression setting in where they're not going out to their, Saturday festivals like they did, or maybe they're not going to church as often. They're not wanting to engage in that social activity because they're confused, and they honestly are probably aware that some things are slipping, and they do not want to do that in front of people that they love and appreciate. So now that I have kind of told you guys the 10 warning signs, let's just go ahead and talk about kind of the process and what we want to do once you have observed those signs. It can be a very hard decision, and obviously I know that some people who struggle with early Alzheimer's disease, early dementia, they do not want to be confronted. They do not want to be told that they're forgetting things. It is very difficult to tell someone, they can no longer drive, or maybe they, maybe they do need some assistance. Maybe that's so hard. That is such a big transition, and I encourage you guys to find support, find local groups, go to your church. I will, in the link below, have certain different groups that I have found. Obviously, they will be different depending on your location, but I have tried to find things that are obviously located across the whole nation that helps with supporting in Alzheimer's disease and dementia. Obviously, there are some conflicting recommendations as to what treatment and how to prove that you have Alzheimer's disease, but I do just always recommend, if you know anyone with these warning signs, I would obviously advise you to observe and keep observing. Their safety is most important. Simply just make an appointment with their primary care, just a regular checkup. I would suggest that someone goes with that person that may be struggling, obviously, because there does need to be kind of a second ear listening in on the conversation. What they'll do in the office, if they think it's appropriate, is a mini mental exam, just a series of questions. Depending on whether or not they can answer those questions, they will be referred on to further testing by specialists. Now, these specialists obviously will evaluate the things that they have, and they obviously know things to look for. Now, the test that will be done by the specialist is just a series of standardized testing. Let's just talk about some of the protective factors that we can take. Obviously, some of this cognitive impairment, Alzheimer's disease, dementia, can be genetic. It also can relate to other mental illnesses maybe you have. So the first is dietary, and dietary includes regular intake of vitamin C, regular intake of turmeric, which turmeric is a root which most health food stores will carry. You can take it as a tea form. I think some people even use it as far as cooking. There may also be a supplement available. I will try to link, like I said before, all of these in the description box below so that you guys can have resources to that. Next would be a high intake of fatty acids. So that's your fish oil. Obviously, folic acid and vegetables are essential. And also, you are going to want to stay away from low saturated fats. Behavior protective stuff includes cognitive activities, physical activities, and social engagement. So Are you doing those puzzles? Are you doing those Sudokus? Are you doing things that make your brain think, make your hands work? Are you going out to those social activities? Are you being social? Are you going to church? Are you volunteering? All of those things do make a difference. So I hope that this video was helpful. I hope that I gave you guys just some good things to look for, just things to evaluate. Obviously, I am a huge advocate for mental health. I think that this is something very important from my own experience with dealing with family and patients. It is always just sad, but a blessing at the same time to see people who love and support, and it's hard. It is, Alzheimer's disease is not easy. It's not easy for the family. It can be a lot of work, but it is something that people go through. So I hope that you enjoyed this video. If you would like to see more videos like this of me just giving different health and wellness tips as far as different diseases and things that go along, I would hope that you would please leave me a comment. If you know of any other Alzheimer's or dementia groups that I did not list below, please also let me know. I am always looking for different resources to check out and give to friends and family. So I hope that you guys got information from this video that will be helpful, and I will see you at my next health and wellness.